Dr. Stenchi, the next couple of questions are for you again, so feel free to elaborate or keep it brief as much as you want. The first is that, does the treatment for DLBCL have severe side effects?
Yeah. So, um, and if we talk about like the first line therapy for R-CHOP, I do think that their patients respond very differently. And so, I, when I see my patient, I usually tell them um, a lot of side effects that can happen, but I also tell them that obviously not all of these side effects are going to happen, but it's really hard for me to predict which side effects will happen in which patient. So there's some side effects that we know are always going to happen. So for example, chemotherapy in general, it can't tell the difference between a cancer cell and a good cell, right? It kills every cell that's rapidly dividing in your body. So that doesn't mean every cell is rapidly dividing in your body, but there are very specific cells that are. So for example, I tell my patients that most likely they will, lose their hair or their hair will at least thin. In general, at the beginning, that's patients' biggest concern that they're going to lose their hair. And I can tell you for my experience, they immediately stop caring about it. It becomes something that they just is insignificant to them. Most of the time, because patients with diffuse large B-cell lymphoma feel really bad before they start therapy. And then when we start therapy, they can actually start to feel much better. So they kind of let that one go. It does destroy a lot of the cells in your gastrointestinal tract. So you can have nausea, you can have vomiting, you can have diarrhea. One of the chemotherapies can actually also make you constipated. So when I tell them you obviously can't have all these things at the same time, you can't be constipated and have diarrhea. I don't know which one you'll have, but the most important thing is really just being in touch with your doctor so they know what's going on with you. Similarly, we know that the cells in your bone marrow are gonna be destroyed. So the cells, like their red blood cells, your white blood cells, your platelets. Usually with R-CHOP, we don't have so much of a hard time with platelets. But sometimes for people who start with low hemoglobins, they may need a blood transfusion some point during treatment. And obviously, we know the white blood cells are always going to go low. So one of the things that we have to give them is something called growth factors, and it stimulates the white blood cells in the bone marrow to grow. That drug can actually cause bone pain. Especially sometimes in younger patients, since they have kind of like thicker, stronger bones, they feel it a little bit more. So yes, there are toxicities associated with chemotherapy. They are all manageable. I think the most important thing is, again, just being very close proximity and like keeping in touch with your doctor so that they know how to help you when these symptoms are happening.
And